Recently, there's a lot of fear and confusion surrounding the coronavirus called COVID-19. The media have been firing off information many consider fear-mongering. But fear is the last thing anyone wants to spread because even though it's a global pandemic, this doesn't mean it's the end of the world. Here are the top 10 facts you will want to know about the COVID-19. 10. What is a coronavirus? Coronaviruses are a large family of viruses. Human coronaviruses commonly affect our respiratory tract, similar to the common cold and the flu. COVID-19 is a new disease that has not been previously identified in humans. There have been 2 other specific coronaviruses that have spread from animals to humans and which have caused severe illnesses in humans. These are the Severe Acute Respiratory Syndrome Coronavirus or SARS, which occurred in 2003. Middle East Respiratory Syndrome Coronavirus or MERS, which occurred in 2015 and 2018. 9. Are there vaccines available for the COVID-19 yet? The answer is no. While coronaviruses are respiratory illnesses, these infections are not the same as those that cause the flu. If you have received a flu vaccine, it will not protect against coronaviruses. 8. How is COVID-19 transmitted? The virus can be spread through close contact, which is generally considered to be a distance of 6 feet or 1.8 meters. It can also be spread via respiratory droplets, which are produced when a person coughs or sneezes. A third way it can be spread is by touching contaminated objects or surfaces, then touching your eyes, nose, and mouth. 7. How is COVID-19 detected or confirmed? Right now, we use the real-time reverse transcriptase polymerase chain reaction, also known as the RRT-PCR, to detect the presence of the coronavirus in respiratory specimens. It takes a few hours to get the results. 6. Who is at risk? Everyone is at risk for this virus, so even if you are young and healthy, be cautious and protect yourself. Those who are at higher risk are the older adults and those with chronic medical conditions, such as lung disease, diabetes, heart disease, etc. 5. What are the symptoms of COVID-19? Common signs of infection include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia in both lungs, kidney failure, and even death. 4. What is the mortality rate of this virus? The mortality rate of COVID-19 is approximately 4%, and while that number may seem low, it's not. The flu has a mortality rate of 0.1%, which sees an average of 1 death per 1,000 people. For patients who are 80 and older, the mortality rate is about 15%. For patients between the ages of 70 and 79, the mortality rate is about 8%. 3. How to protect yourself. Avoid non-essential gatherings and crowded places. Wash your hands often with soap and water for at least 20 seconds, especially after using the washroom and when preparing food. Use alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Keep a distance of at least 2 arms length or about 2 meters from others. Wear a face mask whenever you leave your house. Masks are effective at capturing droplets, which is a main transmission route of coronavirus, and studies have estimated a roughly 5-fold protection versus no barrier alone. 2. How to manage stress and anxiety while being stuck at home. The outbreak of the coronavirus can be stressful for a lot of people. If you feel stressed, take a break from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take good care of yourself. Try to exercise regularly, get plenty of sleep, and eat balanced meals. Avoid alcohol and drugs. Connect with others. Talk with people you trust about your concerns and how you are feeling. 1. What to do if you think you are infected with COVID-19? This is the question that we've all been waiting for. First of all, don't panic. Panicking doesn't help you or your loved ones, so you need to take care of yourself to ensure you get proper care. If you develop a fever and cough, you should call your healthcare provider and ask for their advice. They will know the right questions to ask to help determine if you've got the common cold or if you have something more serious. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. Call your local public health department for information on the best place to go. In all cases, follow the guidance of your healthcare provider and local health department.